Right now, there are 120,000 people over the age of 60 in this country walking around with undiagnosed pancreatic cancer. 92% of them will be dead within 18 months. Almost all of them already noticed the first warning sign at least 3 months ago. They did not ignore it. They called it getting older. They called it a bad back. They called it not sleeping very well. And their doctor agreed with them. That is not a failure of medicine. That is exactly how this disease works. It does not produce strange, unrecognizable symptoms. It produces exactly the symptoms you have already learned to ignore after the age of 60. There is no routine screening test. Your doctor cannot feel your pancreas during a standard checkup. Your annual blood work will miss 82% of stage 1 pancreatic cancer. The only thing that will ever catch this early is you. And that starts with knowing the 7 signs that are never, ever normal. None of these are on the standard pamphlet your doctor hands out. Almost all of them have been reported by 90% of patients at least 3 months before their diagnosis. First sign, cycling dark urine. Everyone will tell you this is dehydration. Drink more water. And here is the cruel trick. If you drink more water, it will go away. For 12 hours. Then it will come back. That is the difference. A dehydrated person's urine stays light once they drink water. A pancreatic tumor pressing on your bile duct will cause dark urine that gets better temporarily, then returns every single day for weeks. If this has been happening for more than 2 weeks, it is not dehydration. Second, the back pain that lies. 70% of patients first go to their doctor complaining of back pain. They are prescribed physical therapy. They get muscle relaxers. Nothing works. This pain has a very specific signature no one tells you. It starts just below your breastbone, then wraps around your body like a tight band, and settles dead center in your middle back. It gets noticeably worse 45 minutes after you eat. It gets worse when you lie flat. Most people with this symptom start sleeping in a recliner after 2 months and never stop to ask why. Ibuprofen does nothing. Heat does nothing. That is not a pulled muscle. Third, early satiety. You sit down to eat a meal you were looking forward to, you take 3 bites, and you are full. Completely full. You tell yourself your appetite just isn't what it used to be. That is not your appetite changing. That is a tumor growing behind your stomach, physically pressing on it from the outside, reducing how much it can hold. This is the single earliest symptom of all, appearing on average 4.5 months before any other sign. Almost no one ever mentions it to their doctor. Fourth, unexplained blood clot. This is the one that almost no doctor will connect to your pancreas. If you are over 60 and you develop a blood clot for no obvious reason, no surgery, no long car ride, no injury, there is a 1 in 7 chance that it is the first sign of pancreatic cancer. The tumor releases proteins that change how your blood clots up to 6 months before any other symptom appears. If this has happened to you in the last year, you need to ask for an abdominal scan. Not tomorrow. This week. Fifth, greasy floating stool. This is the sign no one talks about. When your pancreas cannot release digestive enzymes, the fat you eat passes right through your body unchanged. Your stool becomes pale gray, almost clay-colored. It leaves an oily sheen on the surface of the toilet water. It floats. And it smells worse than anything you have ever experienced. This is not something you ate. This is not IBS. This is a mechanical failure of your pancreas, and it is not normal. Sixth, relentless itching. You itch all over. No rash, no bites. Lotion does nothing. Antihistamines do nothing. You scratch until you bleed, and it does not stop. Almost every medical list will tell you this is a sign of jaundice. What they do not tell you is that this itching starts 3 full weeks before your skin or eyes turn yellow. By the time you notice jaundice, you have already lost 3 weeks of time. Seventh, weight loss you did not try for. If you have lost more than 10 pounds in the last 2 months without changing your diet or exercise, that is not a good thing. That is the single most serious warning sign in all of medicine. There is no benign, common reason for this to happen after the age of 60, ever. Now let me tell you the part that no other video will say. If you have even 2 of these symptoms, you do not go to your doctor and say, "I've been feeling a little off." You write down exactly what you have, exactly how long you have had it, and you read that list out loud. Vague complaints get sent home with antacids, specific symptoms get scans, and if your doctor dismisses you, go to another one. Pancreatic cancer is not a death sentence. If you catch it at stage 1, the 5-year survival rate is 84%. If you catch it at stage 4, it is 3%. That is the difference. That is all the difference there is. The window is open right now. It does not stay open. You did not watch this video by accident. You watched it because something has been feeling wrong for a while, and you could not put your finger on it. Now you can. Do not go back to calling it aging. You know too much now to do that. If this helped you, share it with someone you know who has been complaining about their back, who keeps saying they are just tired. You might think you are sending them a video. You might actually be giving them the 3 months that no one else will.